Welcome to today's video about the symptoms of bladder cancer. What if your body has been sending you warning signals for weeks, but you've been dismissing them as nothing serious? Right now, as you watch this video, someone just discovered blood in their urine for the first time. Another person is experiencing their 5th urinary infection this year, unaware that something far more serious might be lurking beneath the surface. This year alone, over 84,000 Americans will face a bladder cancer diagnosis. The shocking truth? Many of these cases could have been caught earlier if people recognized the warning signs their bodies were desperately trying to communicate. Bladder cancer ranks as the 7th most common cancer overall, yet it remains one of the most misunderstood and overlooked diseases. What makes this even more alarming is that research shows early detection can mean the difference between a highly treatable condition and a life-threatening battle. Some of these symptoms are so common that you might be experiencing them right now without realizing their potential significance. Today, we're revealing the 15 critical symptoms that could save your life. Are you ready to decode what your body might be telling you? Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description.
All right, here's the list of bladder cancer symptoms, starting with number 1, blood in urine. The most dangerous symptom is often hiding in plain sight, blood in your urine. Research shows this appears in 80% of all bladder cancer cases, making it the most reliable early warning sign. But here's the terrifying part. The blood doesn't always announce itself dramatically. Sometimes your urine appears bright red or dark brown, impossible to ignore. Other times, the blood remains completely invisible, only detectable through laboratory testing. This microscopic blood can disappear for weeks before returning, leading people to dismiss it as temporary. What makes this symptom particularly deceptive is that it's typically painless. Cancer cells in the bladder lining are fragile and bleed easily, but without pain, many people ignore this critical warning sign. Whether visible or microscopic, any blood in urine demands immediate medical attention. Medical authorities emphasize that blood in urine is never normal at any age. Don't gamble with your life. This symptom requires urgent evaluation by a healthcare professional. Next, symptom 2, frequent urination. Your bathroom habits might be screaming for help, but are you listening? Frequent urination can signal that something sinister is growing inside your bladder. Research indicates that bladder cancer fundamentally alters urination patterns, forcing multiple bathroom visits throughout the day and disrupting sleep with nighttime urgency. This occurs because cancerous growths reduce your bladder's capacity to store urine comfortably. Imagine your bladder as a balloon. When tumors occupy space inside, there's less room for normal function. Patients often experience this both day and night, progressively worsening over time. What makes this symptom particularly insidious is how gradually it develops. Many people dismiss increased urination as aging or drinking more fluids. However, cancer-related frequency doesn't respond to typical remedies like reducing fluid intake. When you're suddenly making significantly more bathroom trips without obvious cause, your body might be sending an urgent distress signal that demands professional attention.
Next, symptom 3, urgent urination. The sudden, overwhelming panic to reach a bathroom immediately could be more than inconvenience. It might be a life-threatening warning. Urgent urination creates an almost desperate sensation where delaying becomes physically unbearable, even when your bladder isn't actually full. This urgency differs dramatically from normal bathroom needs. Patients describe it as panic-inducing, where postponing urination becomes impossible. Tumors irritate the bladder wall, sending false emergency signals to your brain that the bladder requires immediate emptying.
This symptom often appears alongside frequent urination, creating a torturous cycle where you feel constant pressure, but may only pass small amounts each time. The urgency doesn't respond to typical bladder training techniques that help other conditions. Research shows this symptom particularly affects people with aggressive disease types. When urgency persists without identifiable causes like infections, your body is screaming for medical attention. Don't ignore these desperate signals. They could be trying to save your life. Next, symptom 4, painful urination. When something as basic as urination becomes a painful ordeal, your body is broadcasting an unmistakable emergency signal. Painful urination affects approximately 30% of bladder cancer patients, creating burning or stinging sensations that can range from mild discomfort to excruciating pain. The agony occurs because cancerous tumors create raw, inflamed areas on the bladder wall. When acidic urine passes over these damaged tissues, it triggers intense pain signals. This pain typically occurs during urination rather than before or after, distinguishing it from other conditions. What makes this symptom treacherous is its similarity to urinary tract infections. Many patients assume they have a simple infection and may receive antibiotic treatment. However, cancer-related pain doesn't improve with standard infection treatments. When painful urination persists despite appropriate antibiotic therapy or occurs without fever or other infection signs, immediate further investigation becomes crucial. Don't let persistent pain become your new normal. Relief might require a completely different approach than you imagine.
Next, symptom 5, lower abdominal or pelvic pain. Deep, relentless pain in your lower abdomen or pelvis can signal that cancer has progressed beyond early stages. This type of pain often indicates tumors are growing larger or beginning to invade surrounding tissues. Unlike temporary stomach discomfort, this pain tends to be constant and doesn't resolve with typical remedies. The discomfort occurs because expanding tumors press against surrounding organs and tissues in the pelvic area. Patients describe this as a dull ache, cramping sensation, or pressure emanating from deep within the pelvis. Women sometimes initially attribute this pain to gynecological issues, while men might assume prostate problems. What distinguishes cancer-related pelvic pain is its persistence and progressive nature. This pain doesn't follow patterns associated with menstrual cycles, digestive issues, or muscle strains. It may worsen over time and doesn't respond effectively to over-the-counter medications. When pelvic pain persists without identifiable cause, especially alongside urinary symptoms, medical evaluation becomes absolutely essential for proper diagnosis. Next, symptom 6, back pain. Back pain might seem completely unrelated to bladder problems, but research reveals a terrifying connection that could save lives. Back pain becomes significant when bladder cancer spreads beyond the bladder itself, particularly affecting the lower back region. This isn't typical muscle strain, it's your body signaling that cancer may be advancing dangerously. The pain occurs when cancer spreads to nearby lymph nodes or affects the ureters, tubes connecting kidneys to bladder. This back pain typically manifests as a deep, persistent ache that doesn't improve with rest or standard back pain treatments. Unlike mechanical back pain from lifting incorrectly, cancer-related back pain remains constant and may worsen gradually. This symptom becomes particularly alarming when appearing alongside urinary changes. The pain may include feelings of pressure or fullness in the back area. When cancer affects kidney function by blocking urine flow, resulting back pain can become severe. Persistent lower back pain without obvious cause, especially with urinary symptoms, demands immediate medical evaluation. Next, symptom 7, urine flow changes. Changes in how your urine flows can reveal terrifying information about what's growing inside your bladder. Bladder tumors can physically obstruct urine flow, creating noticeable changes in stream strength, consistency, and your ability to empty completely. These changes often develop so gradually, they're easy to dismiss. Patients may experience weak urine streams, requiring more effort than usual, lacking previous force. Some notice streams that start and stop intermittently, or difficulty initiating urination despite feeling urgent need. Advanced cases may experience complete urinary retention, where urination becomes impossible. These flow changes occur because tumors can grow near the bladder neck, where urine exits, creating dangerous blockages. Men might initially attribute changes to prostate problems, while women may not recognize them as abnormal. Progressive worsening of urine flow, especially with other urinary symptoms, warrants immediate attention. Your urinary system should function smoothly throughout life, and significant flow changes deserve urgent professional evaluation. Next, symptom 8, urinary tract infections. Recurrent urinary tract infections without clear cause might be your body waving a desperate red flag. Frequent infections can sometimes mask bladder cancer or occur more commonly in people developing this disease. When infections keep returning despite appropriate treatment, deeper investigation becomes critically necessary. The connection occurs because cancerous tumors create areas where bacteria can hide and multiply, making infections more likely and harder to clear completely. These infections may also cause inflammation that makes detecting underlying cancer during routine examinations difficult. What makes this symptom particularly dangerous is misdiagnosis potential. Women especially may experience delayed bladder cancer diagnosis because blood in urine and urinary symptoms are initially attributed to recurring infections. Some patients experience infection-like symptoms, burning, urgency, frequency, without actually having detectable bacterial infections. If you're experiencing recurrent infection symptoms, especially with blood and urine, don't accept repeated infections as normal. Your body might be desperately trying to communicate something far more serious. Next, symptom 9, fatigue. Overwhelming tiredness that doesn't improve with rest might signal more than just busy lifestyle stress. Persistent fatigue affects many bladder cancer patients, often appearing as an earlier symptom that gets overlooked or attributed to aging, stress, or other life factors. Cancer-related fatigue differs dramatically from normal tiredness. This exhaustion feels profound and doesn't improve with sleep or rest. Patients describe feeling completely drained of energy even after minimal physical activity, with fatigue worsening over time rather than fluctuating. Several factors contribute to this exhaustion. Chronic blood loss from bladder bleeding can lead to anemia, reducing your body's oxygen-carrying capacity and leaving you constantly tired. Additionally, your immune system's fight against cancer cells requires tremendous energy. When fatigue persists for weeks without identifiable cause, medical evaluation becomes important. Cancer-related fatigue often affects concentration, work effectiveness, and enjoyment of daily activities. Don't assume persistent exhaustion is just aging or stress. It could be something far more serious. Next, symptom 10, loss of appetite and weight loss. Unexplained weight loss and diminished appetite can be your body's desperate distress signal, demanding immediate attention. Significant weight loss, typically 10 pounds or more without trying, occurs in many bladder cancer patients, particularly as disease progresses to advanced stages. Weight loss happens through multiple mechanisms. Cancer cells consume significant energy as they grow and divide, essentially competing with your body for nutrients. Many patients experience chronic pain, medications, or the body's inflammatory response to cancer. This symptom becomes particularly concerning when occurring alongside other bladder cancer warning signs. Unlike intentional weight loss from diet or exercise, cancer-related weight loss often happens despite maintaining normal eating habits or accelerates when appetite decreases.
appetite changes can be subtle initially, finding favorite foods less appealing or feeling full more quickly during meals. Some patients experience taste changes, making eating less enjoyable. Unintentional weight loss or significant appetite decrease without obvious cause warrants immediate medical attention.
Next, symptom 11, swelling in legs. Swelling in your legs or feet might seem completely unrelated to bladder problems, but research reveals this can be a terrifying late-stage warning sign. Leg swelling occurs when bladder cancer spreads to lymph nodes in the pelvis, or when tumors block normal fluid drainage from the lower body. This swelling differs from temporary puffiness caused by standing too long or eating salty foods. Cancer-related leg swelling tends to be persistent, progressive, and may affect one or both legs. The swelling occurs because lymph nodes, which normally drain fluid from tissues, become blocked or damaged by cancer spread. This symptom typically appears in advanced bladder cancer cases, often accompanied by other alarming signs like severe pain or urinary obstruction. The swelling may start gradually and worsen over time, potentially affecting mobility and comfort. When leg swelling appears alongside urinary symptoms, immediate medical evaluation becomes absolutely crucial. This symptom can indicate cancer has affected blood vessels or caused kidney problems due to blocked urine flow. Next, symptom 12, bone pain. Deep, persistent bone pain that seems to emanate from within your skeleton can signal that bladder cancer has spread beyond its original location. When bladder cancer metastasizes, bones are among the most common sites where cancer cells establish new tumors, particularly affecting the spine, pelvis, and ribs. This bone pain differs dramatically from typical aches and pains. Metastatic bone pain is often described as a deep, constant ache that may worsen at night and doesn't improve with rest or over-the-counter pain medications. Unlike arthritis or muscle pain, this discomfort seems to come from deep within the bone itself. The pain occurs because cancer cells in bones can weaken bone structure and trigger inflammatory responses. Patients may experience constant pain or notice it worsens with movement or pressure. Some describe it as a gnawing or boring sensation that's impossible to ignore. Bone pain from metastatic bladder cancer often appears in weight-bearing bones like the spine and pelvis, potentially accompanied by increased fracture risk. Next, symptom 13, anemia and iron deficiency. Hidden blood loss from bladder cancer can gradually drain your body's iron stores, leading to anemia that develops so slowly you might not notice until it becomes severe. Chronic bleeding from bladder tumors often causes iron deficiency anemia, particularly when blood in urine isn't always visible. Anemia occurs because your body can't produce enough healthy red blood cells to replace those lost through bleeding. This condition develops gradually, allowing your body to partially adapt, explaining why symptoms may seem mild initially but worsen over time. Cancer-related anemia symptoms extend beyond simple tiredness. Patients may experience pale skin, brittle nails, unusual cravings for ice or starch, restless leg syndrome, and difficulty concentrating. This type of anemia doesn't improve with dietary iron supplements alone because underlying bleeding continues. Anemia can occur even when blood in urine isn't visible. Blood tests revealing low hemoglobin, low iron levels, or characteristic red blood cell changes can provide crucial diagnostic clues requiring immediate investigation. Next, symptom 14, difficulty emptying the bladder. The frustrating sensation of incomplete bladder emptying can signal that tumors are dangerously interfering with normal urinary function.
Bladder cancer patients often experience urinary retention, where the bladder doesn't empty completely during urination, leaving them feeling like they need to urinate again shortly after bathroom visits. This incomplete emptying occurs when tumors grow near the bladder neck, or urethra, creating partial obstructions preventing normal urine flow. Patients may feel like they're still holding urine even after urinating, leading to frequent bathroom trips with only small amounts passed each time. Severe cases may progress to complete urinary retention, where urination becomes impossible and requires emergency medical intervention. This represents a urological emergency that can cause kidney damage if not treated promptly. This symptom often worsens gradually, starting with mild feelings of incomplete emptying and potentially progressing to severe retention. Patients may need to strain during urination or change positions to empty their bladder more completely.
Next, symptom 15, abdominal pain. Persistent abdominal pain that comes and goes or refuses to disappear entirely can be your body alerting you to serious bladder problems. Abdominal pain appears in many bladder cancer patients, particularly when tumors grow larger or cancer begins affecting surrounding organs and tissues. This pain differs from typical stomach discomfort caused by indigestion, gas, or temporary digestive issues. Bladder cancer-related abdominal pain tends to be located in the lower abdomen and pelvis area, often described as a deep, aching sensation that may intensify with a full bladder or during urination. The pain occurs because enlarged tumors can press against abdominal organs, stretch the bladder wall, or cause inflammation in surrounding tissues. This discomfort may be accompanied by feelings of pressure or fullness in the lower abdomen, even when the bladder isn't full. When abdominal pain persists without identifiable cause, medical evaluation becomes important. This symptom becomes particularly concerning when appearing alongside urinary changes or other bladder cancer warning signs. Knowledge is your most powerful weapon against bladder cancer, and recognizing these 15 symptoms could literally save your life or the life of someone you love. The research is absolutely clear. Early detection dramatically improves treatment outcomes and survival rates. Bladder cancer caught in early stages has significantly better prognosis than cancer discovered after spreading. Remember, having one or more of these symptoms doesn't automatically mean you have bladder cancer. Many conditions can cause similar signs. However, the presence of these symptoms, especially blood in urine or multiple symptoms occurring together, warrants immediate medical attention. Don't let fear or embarrassment delay potentially life-saving care. The most important action you can take today is paying attention to your body's signals and advocating for your health. If you're experiencing any of these symptoms, schedule an appointment with your healthcare provider promptly. If this video was helpful, kindly type "helpful" in the comment. That motivates us to produce more content like this. Please like this video, share it with family and friends who need this information, and subscribe to our channel for more health awareness content. Thank you for watching and taking charge of your health.